Well, good morning and welcome to the Public File. My name is Kat Modrew. My guest for this part of the Public File program, we meet again, Dr. Dennis Breen. He's a clinical cardiologist at Sacramento Heart. Nice to see you again.
Good morning, Kat.
I met Dr. Breen when I went down and had a heart scan. I guess it was a couple months ago. And as he explained in such human words and terms what all the heart scan meant, while he was talking, I was thinking, gotta have him on my show. So here you are, and thanks so much for coming in.
Well, thanks for the invitation.
So for people who have heard about Sacramento Heart and about heart scans, talk a little bit about what this procedure is, and a little bit of history behind the heart scan. I feel like it's been around maybe 5-10 years.
Exactly. This is something that's new. It's not yet mainstream, and I think people have a lot of misunderstandings, and that's part of the reason why I welcome the opportunity to explain it. This is an application of X-ray and computer technology at its highest and most developed form. It's a way of looking inside our bodies for disease processes that might be lurking there. You know, the way I came to this, I had been practicing medicine for 20 years and never had the satisfaction of making the diagnosis of lung cancer, except in the context of telling someone they had a couple of years to live, perhaps.
Wow.
And that's the sad fact with most diagnoses of lung cancer and with many other cancers. We often find them when they're too far developed.
And everybody knows the phrase early detection.
Exactly. And cancer is hard to detect early because it doesn't make itself known until usually it's far advanced. By the time you have your first symptom of most cancers, it's pretty far advanced. It's probably been there for years, sometimes decades. So this technology allows us to find those cancers before people know they have them.
And that's the amazing thing. You can go in and feel fine, and I'm sure we all know of someone who went in for a routine physical and felt great and had something told to them about a condition that they didn't even know existed. Well, this takes it a step further than an examination by a doctor at a regular doctor's office. This checks you out from the inside.
This really does. Our bodies are like boxes that are hard to get inside. Our ribs prevent anyone from palpating or feeling any kind of abnormalities in the organs of our chest. And our abdomens are softer, but they're padded so heavily in most of us that it's very hard for a doctor examining your abdomen to feel anything smaller than a baseball. And believe me, by the time a cancer has reached that size, it has spread.
And the interesting thing about the heart scan is, when you have an ailment or you don't feel good, a certain area is looked at for a certain condition. This is sort of an overall scan of everything. When I did my heart scan, there was a little bit of scar tissue on my lungs. I've had pneumonia twice, and I had forgotten about that. There was a little bit of calcification on my spinal cord because I'm pushing 50, a little scoliosis. So the heart was the main event, but all kinds of other areas were looked at.
Well, let's begin with that distinction, because the heart scan is a part of a whole body scan.
Yes.
And I think the best way to look at this is you can look at the big package, which is head to toe, or you can look at the part that is of greatest interest. In some individuals, the heart is the main focus. All of us live in fear of having a heart attack. And I think the heart scan is probably the, you might say, the epitome of application of this technology, because what we do with a heart scan is we actually look for the traces of hardening of the arteries within those arteries that feed the heart muscle, those things that, if they become blocked, cause heart attacks.
Right.
And the way this test works is it uses X-ray technology and computers to look for small traces of calcium that can be deposited in the walls of arteries as hardening or plaque begins to form. So we can see the equivalent marker of cholesterol in the coronary arteries in the form of calcification of those arteries.
So that's the heart scan, but what this machine can do is scan you from head to toe. And for you claustrophobic people like me, it's not an enclosed machine. When I was asked if I wanted to participate in this study or in this promotion, I'm thinking, I'm very health conscious, so I'm a person who's okay with finding out what there is to find out, which other people need to be better about. But I was concerned about being closed into a tube, and it's a completely open procedure, which is such good news.
Exactly. This is a donut, not a tube. So if you can imagine a big metal donut, and all the individual needs to do is lie on a little bed that slides in and out of the donut. So if you have problems with claustrophobia, you don't need to worry.
Very good. Now, I imagine people come to Sacramento Heart in different ways. Are they sometimes suggested by their doctors that recommend it that they get a full body scan or a heart scan?
Exactly. Many of our patients are referred by their physicians. This is a service to the community. Anyone can access it. Any physician is welcome to send a patient in. And we also make it available to the general public. But we also try to provide guidance for people. This isn't something you do for curiosity. It isn't something you do for fun. It's something that you have to understand carries with it some risk. There is radiation involved, so therefore we don't do this except in situations where we think that the benefits outweigh the risk. And there's cost, of course. No one likes to spend money needlessly, so we tell people, obviously, you want to invest your healthcare dollars wisely. But the biggest risk of this test, if you want to discuss the risk, there is radiation involved. We don't want people of childbearing age to do this test, for instance. So I discourage women, let's say under age 50, certainly women who are premenopausal. It isn't necessary to do this, except in rare circumstances. The people who should do this kind of whole body scanning or heart scanning, if you want to be focused on the heart alone, are people who have family histories of heart disease or early heart attacks, or people who have multiple risks. For instance, former smokers or current smokers. Those people are at high risk for lung cancer. People who have high cholesterol, high blood pressure, who have diabetes. These are people who are at higher risk for heart attacks than the average person or the average population. So if you're over 50, if you're a former smoker, if your family includes individuals who had heart attacks in their 50s or 60s, these are the individuals who should think about a heart scan.
If you're just joining me, my guest is Dr. Dennis Breen. He's a clinical cardiologist with Sacramento Heart. So what does a person do with this information? In my case, I got the equivalent of an A.